There's a moment I've watched happen in my office more times than I can count. A husband and wife sitting across from me, and the wife says, quietly, almost apologetically, "He's just not himself lately." And the husband looks a little embarrassed, a little defensive, and says something like, "I just forget things now. That's what happens when you get old." And here's the thing, sometimes that's true, but sometimes it isn't aging at all. Sometimes it's something sitting in a little orange bottle on the kitchen counter, something they've been taking for years without a second thought. I want you to imagine something with me for a moment. You wake up, you walk into your kitchen, you open the refrigerator, and you just stand there. You genuinely can't remember what you came for. You laugh it off. Everybody does that, right? But what if I told you that for some of you watching this, that moment isn't just a senior moment? What if one of the medications you take every single morning, the ones that feel as routine as brushing your teeth, is quietly working against your memory? I'm not saying this to frighten you. I'm saying it because thousands of older adults experience confusion, brain fog, and memory changes every year that are connected to medications, not disease. And in many cases, once the medication is reviewed, some of that fog lifts. Not always, not for everyone, but often enough that I think every person over 60 needs to hear this. Today I want to walk you through 6 categories of medications that deserve a closer look. Medications that research has connected to memory and thinking changes in older adults. Now, I want to be very clear about something right from the start because I take this seriously. I am not telling you to stop any medication. Please don't do that. Some of these drugs are keeping people alive, keeping them out of the hospital, keeping them comfortable. What I am telling you is this: talk to your doctor. Ask questions, because knowledge in this case might be the thing that protects your mind for years to come. And stay with me until the end, because the 6th one on this list surprises almost everyone I share it with, including some of my own colleagues. Now let's talk about why this even matters so much once we pass 60. When you were 30, your liver processed medication like a factory running at full capacity. Your kidneys filtered your blood efficiently, clearing out whatever your body no longer needed. Your brain had what we sometimes call cognitive reserve, a bit of a buffer, extra wiring that could absorb small disruptions without you ever noticing. By the time most of us reach our 70s, that factory is slowed down. Not stopped, just slowed. Medications stay in your system longer. They build up more easily. And the brain, which used to shrug off small chemical disruptions, becomes more sensitive to them. Here's an analogy I use often with my patients. Think of your body in your 30s as a fast-moving river. Whatever goes in gets carried out quickly. Your body in your 70s and 80s is more like a slow-moving stream, sometimes closer to a pond. Things that go in tend to linger. And when medications linger longer than they're supposed to, side effects that used to be mild can quietly become more pronounced, more persistent, and yes, sometimes more dangerous, particularly when it comes to confusion and falls. And I'll be honest with you, many seniors are taking 5, 6, 7, sometimes 10 different medications at once. We call this polypharmacy. Each one might make sense on its own, but when you stack them together, the combined effect on the brain and body can be much greater than any single prescription would suggest. It's a little like asking 6 different people to whisper in your ear at the same time. Individually, none of them are loud. Together, it's very hard to think clearly. So let's get into the first one. Long-term use of certain sleeping and anxiety medications, specifically a class called benzodiazepines. You may know them by names like alprazolam, lorazepam, diazepam, or clonazepam. Many people were prescribed these years ago for a stressful season of life, a divorce, a death in the family, trouble sleeping after retirement, and what started as a short-term solution somehow became a decade-long habit. These medications work by calming down brain activity. That's exactly why they help you sleep or feel less anxious. But that same calming effect over months and years can slow reaction time, reduce alertness, and in older adults specifically has been associated in research with a higher risk of falls and in some studies with cognitive decline. I want to be fair here. Scientists are still studying exactly how strong that connection is, and whether it's the medication itself or the underlying anxiety and sleep problems that play a role. But the association shows up often enough that most geriatric specialists, myself included, recommend regularly reviewing whether long-term use is still necessary. I had a patient, I'll call him Walter, 78 years old, retired mechanic, sharp as a tack his whole life. His daughter brought him in because she said conversations with him felt different, slower. He'd asked the same question twice within 10 minutes. Walter had been taking lorazepam nightly for almost 12 years, ever since his wife passed. Nobody had ever really revisited that prescription. We worked closely with him, very slowly, very carefully, under medical supervision to taper it over several months. I'm not going to tell you it solved everything, but Walter's daughter told me 3 months later that he felt more like himself than he had in years. If you've been on one of these medications for a long time, please don't stop cold turkey. That can actually be dangerous. What I want you to do is bring it up at your next appointment. Ask your doctor, is this still the right choice for me? Is there a safer way to manage this now? Now, medication number 2, and this one surprises people because it's sitting in almost every medicine cabinet in America. First-generation allergy medicines. Diphenhydramine, which most of you know as Benadryl, and chlorpheniramine. These are what we call anticholinergic medications. That's a big word, so let me simplify it. Your brain uses a chemical messenger called acetylcholine to help with memory, learning, and muscle control. Think of acetylcholine as your brain's mail carrier, delivering important messages between brain cells. Anticholinergic medications essentially block some of those deliveries. Fewer messages get through, and things like memory, focus, and even bladder or bowel control can be affected. Now, taking a Benadryl once in a while for a bee sting or seasonal allergies isn't going to hurt you. But some of my patients take it every single night, for years, simply to fall asleep faster. And research has found that a high cumulative anticholinergic burden, meaning regular use over a long stretch of time, has been linked to a higher risk of cognitive decline in older adults. Again, association, not absolute proof for every person, but strong enough that many pharmacists and physicians now actively steer seniors away from long-term nightly use. The good news is there are often other options. Newer generation allergy medications tend to have a much lower effect on the brain for many people. That's a conversation worth having with your doctor or pharmacist. Now, if you're finding this helpful so far, I'd genuinely love it if you hit like on this video and consider subscribing. And I mean this sincerely. I read the comments on these videos. Tell me your age and where you're watching from today. I've had people comment from small towns in Ohio, from Ontario, from the coast of England. It means a lot to know who's actually sitting on the other side of this screen. Medication number 3 is one that catches people off guard because of the irony involved. Certain overactive bladder medications, oxybutynin and tolterodine among them. Think about that for a second. These medications are prescribed to help with bladder control, something incredibly important for dignity and independence as we age. Nobody wants to avoid leaving the house because they're worried about an accident. I understand that completely. But oxybutynin in particular carries a fairly significant anticholinergic effect, that same acetylcholine blocking mechanism we just talked about with allergy medicines. I remember a patient, a woman named Dolores, 71, who'd been on oxybutynin for about 4 years for bladder issues. Her son mentioned during a visit that she'd started forgetting to turn off the stove, something completely out of character for a woman who used to run a small bakery and manage inventory in her head. We reviewed her medications together, and her physician transitioned her to a different type of bladder medication with less impact on cognition. Her son later told me she seemed sharper within a couple of months. I share that story not to scare anyone off these medications, because bladder control matters deeply for quality of life, but simply to say, this is exactly the kind of thing worth asking your doctor about directly. Are there bladder medications available with less impact on memory? Have you or someone you love ever noticed a change in memory shortly after starting a new medication? I'd really love to hear about it in the comments below. These stories help other people watching recognize patterns in their own lives that they might not have connected before. Medication number 4 brings us back to anti-anxiety medications, but I want to focus specifically on long-term ongoing use rather than the sleep-focused use we discussed earlier. Many seniors take these daily, sometimes for decades, to manage generalized anxiety. Here's what happens over time. Your body builds tolerance, meaning you may need more of the medication to get the same calming effect. Dependence can develop, which is different from addiction, but still significant. And that same brain-slowing effect I described earlier compounds with continued use, contributing to slower thinking, delayed reaction time, and yes, increased fall risk. Falls, by the way, are one of the leading causes of hospitalization and loss of independence in older adults. A hip fracture at 75 can change the entire trajectory of someone's life. So when I talk about medications affecting reaction time and balance, I'm not just talking about memory in an abstract sense. I'm talking about your ability to catch yourself when you trip on a rug, to react quickly in the shower, to stay steady walking your dog on an icy sidewalk in February. This is exactly why these medications deserve a yearly review with your physician. Not because they're bad medications, but because your body today is not the same body it was when the prescription was first written 5 or 10 years ago. Medication number 5 is one I want to approach with real gentleness, because I never want anyone watching this to feel ashamed. Strong opioid pain medications, morphine, oxycodone, hydrocodone. If you live with chronic pain, whether from arthritis, an old back injury, or years of hard physical work, you deserve relief, full stop. Nobody should judge you for that. But I do want you to understand what these medications can do to the brain, particularly as we age. Opioids work on receptors throughout your brain and body, and one of their most common side effects, especially at higher doses or with long-term use, is what patients often describe as brain fog, a kind of mental cloudiness, slower processing, increased drowsiness. And because of that slower thinking and delayed reaction time, the risk of falls climbs meaningfully, especially in adults over 70. I had a patient named Raymond, 76 years old, a retired carpenter who'd been on hydrocodone for chronic back pain for years following an old work injury. His wife noticed he was starting to lose his train of thought mid-sentence, something that had never happened before. We didn't take him off his pain medication because his pain was very real and needed to be managed. Instead, his doctor adjusted his dosing schedule and added other non-opioid strategies alongside it: physical therapy, gentle stretching, even something as simple as a warm compress routine in the evenings. Over time, some of that fog lifted while his pain remained reasonably controlled. The message here isn't to fear pain medication. It's to have an honest conversation with your doctor about whether your current dose and combination is still the right fit, and whether there are complementary approaches that might reduce how much medication you need overall. Now, medication number 6. This is the one that genuinely surprises people because it's one of the most commonly prescribed medications in the entire country, and most people don't think of it as having anything to do with the brain at all. Long-term acid reflux medications, specifically proton pump inhibitors like omeprazole and pantoprazole. I want to be very balanced here because these medications have genuinely helped millions of people manage painful, damaging acid reflux, and for many, they are absolutely appropriate to take long-term under medical guidance. This is not a case where I want you walking away frightened. Here's what the research suggests. Long-term and often unnecessarily prolonged use of these medications can interfere with the body's absorption of vitamin B12, and B12 deficiency itself, independent of the medication, is well known to affect memory, nerve function, and even mood. Some studies have explored a possible link between long-term PPI use and dementia risk directly, but I want to be honest with you, the evidence there is mixed and far from settled. What is clearer is the B12 connection, and that alone is worth paying attention to. I think of it this way. It's not necessarily the medication attacking your brain directly. It's more like the medication quietly closing a door that a nutrient needs to walk through. And over years, that nutrient shortage can catch up with you. If you've been on one of these medications for more than a year or two, it's worth asking your doctor two simple questions. Do I still need this at this dose, or could we try a lower dose or an alternative? And should we check my B12 levels? So why does all of this matter so much more after 60 than it did at 30 or 40? I keep coming back to that slow river versus slow stream picture because it really is the clearest way I know to explain it. Your kidneys filter more slowly. Your liver processes medications less efficiently. Your body composition changes, often with less muscle and more fat tissue, which changes how certain medications are stored and released into your bloodstream. And your brain, which spent decades building up resilience, becomes more vulnerable to chemical disruption. None of this is your fault. It's simply biology. But it's biology worth understanding, because understanding it gives you power. So let me leave you with something practical. Something you can actually act on this week. Every single year, sit down with your doctor or pharmacist and review every medication you take. Not just the prescriptions. Bring the vitamins, the over-the-counter sleep aids, the allergy pills, all of it in the original bottles if you can. Ask directly, is this still necessary? Is there a safer alternative available now? Never ever stop a medication on your own without guidance, even if you suspect it's causing problems, because some medications carry real risks if stopped abruptly. If you notice new confusion, forgetfulness, or unsteadiness, report it to your doctor promptly, rather than assuming it's simply age. And alongside all of this, keep doing the things that protect your brain regardless of medication. Staying physically active, even if it's just a daily walk around the block. Protecting your sleep. Staying socially connected with friends and family. And eating a diet rich in vegetables, healthy fats, and lean protein. I want to close with something that matters more to me than almost anything else in this conversation. Memory isn't just about remembering where you left your keys. It's remembering your granddaughter's wedding day. It's the melody of a song that takes you straight back to 1974. It's knowing your grandchildren's names the moment they walk through the door. It's the quiet, steady independence of living life on your own terms. Protecting that isn't only about adding another supplement or another prescription to the pile. Sometimes it starts with something much simpler. Taking a careful, honest look at what's already sitting in your medicine cabinet and asking whether it's still serving you the way it once did. If today's conversation helped you understand something new about your own health, or your parents, or your spouse's, please share it with someone you care about. Sometimes people carry on taking a medication for years simply because nobody ever sat down and explained what it might be doing quietly in the background. And if you'd like to keep learning alongside me, subscribe and join me here again soon. Next time, I want to talk about 5 vitamin deficiencies that quietly steal strength, balance, and memory after age 60, and how to recognize the warning signs before they become something more serious. I think you'll find it just as eye-opening as this one. I'll see you then.